The most common mental health across the globe, according to experts, is depression. For a lot of people, the sense of sadness, emptiness, or hopelessness does not dissipate, which is why it affects how people think, feel, or act. Hello and welcome to Let's Talk. I am Olujoke Mosaku. The topic before me today is how to overcome depression. I have here with me Dr. Wale Ojo, addiction psychiatrist, Indiana University. Stay with us and enjoy the rest of the show. Thank you so much, Dr. Wale. It's nice having you here.
Yeah, thank you for the warm introduction. I'm happy to be here.
Okay. So, what is depression and what is the root cause of depression?
Essentially, depression, as you said, is one of the very common mental disorders. And actually, they say it's one of the two mental disorders that cuts across all cultures. So across the world, whatever culture you are in, there is always an element of depression as one and schizophrenia as the second one. So every culture and every group of people around the world experiences depression. Essentially, with depression, the main or the cardinal feature of depression is the fact that the person feels very sad and depressed. They have a depressed mode. But one other thing we also look out for is lack of interest or lack of being able to feel pleasure. And we call that anhedonia. And usually we look at, to make a diagnosis of depression, we look at a constellation of about 7 other symptoms. And we also look at the duration, how long has the person been having these symptoms. So either one of depressed mood with anhedonia plus 4 other symptoms for about 2 weeks would give you a major depressive episode. Now, there are other elements of depression that may not fit into that framework or that box, and we have different names that we call them. For example, persistent depressive disorder, which people used to call dysthymia, which is a depressive episode that isn't really major. It's just kind of simmers there and lasts for about 2 years. There are different elements to what we call depression, but the cardinal feature, like I said, is depressed mood and anhedonia. Now, the other symptoms that we look at when we talk about depression is things like changes in weight and appetite. So, is there any weight loss? Is there any weight gain? A good indication of that will be, has the fellow lost 5% of his weight in the last month? Do you still fit in your clothes? So usually it's weight loss, but sometimes you can have weight gain and increased appetite, especially with atypical depression. We also look at the sleep pattern. And usually with depression, you have insomnia, so lack of sleep. The fellow or the patient or client would, they tend to wake up at the middle of the night. So they have difficulty maintaining sleep. And they also tend to wake up very early, which we call terminal insomnia. With depression, you have what we call psychomotor retardation. So the person usually, the way you talk normally and you gesticulate and you move your body, for someone who is depressed, they don't show those features. So they are more very static, staying in one position, almost no facial expression. They are walking, they are not making the natural movements that people do when they walk. They don't want to do anything, they don't feel like getting. And then you look at the concentration, how much are they able to concentrate at work, for example, at school? People with depression usually have a loss of concentration or a difficulty in making decisions. So they have two choices in front of them and they really can't think through what decision they should make. Then we also have feeling of worthlessness, or feeling of hopelessness and guilt, which is usually very excessive. Guilt about things that really shouldn't matter, or things that went on in the past, a very excessive amount of guilt. And then we lastly would consider the possibility of suicidal ideas. And usually that will range from just having the suicidal ideas to actually attempting suicide. You know, ideas, then intent, then having a plan, then actually attempting suicide.
All right. So, what is the ratio of people with depression in the world in general?
It ranges from about 7% to I would say 15%, but a good value would say is 10% of people would suffer from depression.
So, it's not that bad.
Well, it is. It is
Considering the
because
ratio.
yes, the functional disability that arises from depression is quite phenomenal. You can imagine people going to work and they make mistakes or they really can't function. You know, that's a loss at work. And people depressed enough that they lose their jobs or they don't feel like getting out of bed to go to work. So the effect is quite extraordinary if you think of it in terms of resources in treatment, in terms of lost resources in dealing with depression. So it's quite a lot. It's usually starts in the 20s. It's very unlikely to start at an older age, although the prevalence of depression in older people is actually higher, I would say. The one of the things with depression in elderly people is that we don't necessarily screen for that as much as we should. But it's there and it's present.
But in this age, where I'm very sure that there are teenagers like 12, 11, because there is a precedence to depression.
When I say typically starts in the 20s, doesn't mean that someone can have it lower than that. At any age, you are predisposed or you are able to have depression at any age. In fact, we've seen children less than 10 have depression. But the typical story is for most people is that around their 20s is when, you know, stressful life events are happening. So that's when most people typically develop depression, but you can totally have it start in your old age or even less than 10 years.
So does depression have baggages, things that come with it that could actually affect the people around such a person?
I'll say this in multiple ways. One is the type of depression depends on the age, depends on culture. Let me take age, for example. For adolescents and children, instead of having depressed mode, they have more of irritable mode. So they get very angry easily. And one could mistake this with, you know, being rebellious or being stubborn or, so many people misinterpret that sign as something else. But what is actually going on there is depression. And if you don't investigate properly, you might miss, actually diagnosing and treating depression. So that's one thing that I think is peculiar in younger people. So the parents see that irritability and they're taking it as, this child is being difficult. So it affects that relationship. Two, in terms of culture, now, different cultures have different ways of viewing depression and the way they interpret it. So, for example, patients from Japan or China, the East Asian community, they don't come to the hospital with saying they have depression or they are depressed or sad. They come more with physical symptoms. So they come with, abdominal pain, headache, chest pain. But what's really going on there is depression. And there's a lot of lost resources, diverted to other direction, trying to investigate things that are not really there, while you're missing the actual cause of those symptoms that they are having. So in terms of an individual now having depression, a typical individual in the US, if you look at one of the cardinal symptoms of depression, which is loss of interest or loss of pleasure, that could affect relationships. The other way is in terms of work, for example. So you have depression and you work at the factory and you start making mistakes or you start making errors and people start noticing it. And you have one error and then two and then three, and then they put you on probation or they put you on some sort of punishment and then they eventually fire you. That's loss of income for that individual because of depression. So generally, we try to look at this as loss of function in three areas. So loss of function in terms of interpersonal relationship, which, as I said, relationship with other people. Loss of function in terms of occupation or if for students, education. And then loss of function on the personal level in terms of taking care of yourself. So people who are depressed, sometimes they don't feel like taking a shower, they don't eat good. So these things exacerbate other medical conditions. Depression really cuts across an individual's life and it could really be a life changer.
How can it affect a couple's sexual life?
The sexual bit of it is one of the parts that I think many psychiatrists miss out on. Depression definitely influences or affects the sexual life. It's, causes reduced libido. Of course, sex is one of the pleasurable things that people do. And when you have anhedonia, it means you have loss of interest in those pleasurable activities, including sex. So that's one way. The other aspect of it is that some treatments of depression could also affect the sexual life. So some medications like serotonin inhibitors, reuptake inhibitors, could actually make that one symptom even worse. We will want to avoid treatments that may make that aspect of the patient's life worse. So medications like Zoloft and sertraline, you really want to avoid. And you maybe lean towards things like bupropion or Wellbutrin in terms of medication. And also things like, you could introduce things like couples therapy in terms of treatments.
Okay, for us to continue in that, depression, I read, is also known as clinical depression, and it has enormous risk if not treated. So what are these risks?
The risk of depression, you could divide into things that affect you at an interpersonal relationship level, things that affect you at the work/education level, and things that affect you in terms of personal care. So the interpersonal relationship level could be, breaking up of relationships, or having, like you said, a poor marriage, divorce, um, being estranged from family members, from kids, from your wife, losing friends, things like that. Then on the work/occupation/education level, you could have, loss of your job, you could have demotion, you could have, just generally very poor output compared to how much energy you're investing in. Um, you could have, you could fail classes, you could flunk out of school, you could drop out of school. So usually a patient who is depressed is not able to produce at their maximum level. So there is a reduction in product, whether it be at work or at school, or they are underemployed, and then the interpersonal aspects would be, neglecting things like your personal health. So if you have a medical problem, you're making it worse. The choices of your attire to an event, for example, could be influenced by your mood. If you're depressed, you see a depressed person, they don't care. They are in sweatpants or whatever to a classy event because they don't feel the need to dress appropriately for the events. They are so down and depressed. Um, Sometimes depressed people don't take showers. Uh, they don't feel like brushing their teeth. They don't feel like eating right. They don't even feel like eating sometimes. So these are the ways that depression could affect someone.
How can a depressed person now overcome depression and overcome suicidal thoughts?
So the biologic, for example, will be, genetic. So if you have a first degree relative who suffers from depression, then you are 2 to 4 times more likely to have depression. If you have an hyperactive HPA system, the hypothalamic pituitary axis, and you have increased cortisol, you are more predisposed to depression. Things like decreased norepinephrine and serotonin and things like that. Now, on the psychological end, you have things like temperament. So people who are neurotic, who are OCD-like type A kind of individuals who want things to be perfect, they want things to be a certain way. They are very predisposed to depression. Also, people who um, they have, and we call this the cognitive theory of depression. They have a particular mindset where they catastrophize things, or they don't see things the way other people see it. So they see something that is neutral and they interpret it as being bad. So we call that, that there are different names and different ways of doing that. But essentially, it's one of the things that influences or that increases the risk of depression. Then now things like life events. So there are certain events and trauma that one goes through, growing up, or even through adult life that predisposes you to depress. Several side events that could cause depression. Now, the reason why I bring this up is because some of these things you are able to influence and change. And some of these things you have very little control over. For example, the negative or the life events that I talked about. Now, those things have happened to you, and it's very unlikely that you can go back in time to change them. You understand what I mean?
Yes.
So you just have to, that you can change. But if you have if you have one of the personalities that is predisposed to having depression, if you have one of those temperaments, then you can, identify that and work on ways to help yourself manage your personality without getting depressed. If you had a family member who is depressed, and you have the genes that predispose you to depression, there's not much you can do about that. But if you are in a social situation that predisposes you to depression, for example, if you're homeless, that's something you can do something about. So essentially, or generally, I would also group the things you can do into biologic things, the psychological things and the social things that you could do. Now, in terms of the biology, I would say number one is medication. So we have several classes of medications that are very helpful with, targeting the symptoms of depression. And they are not very effective, but they are quite safe, I would say, most antidepressants. So I know many people have these negative views of medications, but sometimes it's, important and it's necessary. To, like I said, things like stress and sleep, there are things that you could do to improve things like that. So if you're at a workplace that is highly stressful, you are producing more cortisol and you are more, predisposed to depression. So in a situation like that, taking time out to relax, taking time out to sleep, exercising, your diet is also very important, eating right. So in terms of biology, these are the things that you could do to overcome depression. Now, in terms of the psychological things, I would say number one is therapy. And there are different kinds of therapy that we can use for depression. Depends on, the individual, what their temperament is, and what the cause of the depression is.
So finally, what are the things that family, friends can do to help someone who is depressed?
Identifying depression in people who, in your friends and family members is very, very important, because the individuals who are depressed may not realize it at that point. So I would say watch out for their behavior pattern, watch out for their eating habits. If you know someone who is going through very stressful times, just try to have that at the back of your mind. Is this person depressed or not? And once you are able to, once you have a hint of suspicion, I would say you should take them to a professional. Now, not every depression would warrant, recurrent visits to see a psychiatrist or a therapist or even medication, but at least you would have them screened and to be monitored properly. There is nothing like as overabundance of caution. Even if it's a trip to see a family physician, just have them see a professional so that they can get screened properly. And if they need to be in treatment, they will be referred to treatment. The other thing you could do is to, encourage people who are going through a very stressful period. Um, there is power in your words. You might not necessarily have the same effect as a therapist would have. But the fact that you are able to show someone that you love them is actually very protective. Having that sense of commitment to someone else, that there's someone out there that loves me, my mom loves me, I can't do this to her, or my kids love me, so I can't help myself. Those thoughts come into the minds of suicidal people and into the minds of depressed people.
Okay, thank you so much, Dr. Wale. It's been fun having you here. Any final word?
Depression is very prevalent across, every culture. Um, let's not make the mistake of downplaying it, of thinking that we are immune to depression. And as much as we can, to seek the help of professionals when we notice a hint of depression.
Okay, thank you so much. And to you out there, thank you so much for always watching Let's Talk. I hope you've learned one or two things, and perhaps there is someone depressed around you. You now know how to help. And also, if you are going through depression, then take time out to listen again and watch again what Dr. Wale has been able to dish out for us today, and try to play safe. And I know that you will be fine. Life is a process. We are all going through one thing or the other. So you don't need to take your life, or you don't need to get so down about it. There is always light at the end of the tunnel. Until next time, I remain Olujoke Musako. Bye for now.